to use the chief complaint. Okay, we're not going to belabor this. This is, say, why are you here? My eye's killing me. That's the chief complaint. Okay, that's what that's called. And then you're going to ask some questions, and this is going to be in your rubric. You're going to be given the chief complaint, and then the history of present illness is the questions you ask to find out what they mean by my eye hurts. Okay, that's history of present illness. And then when you go through a patient's entire history, these are the components. Their past history, medical history, surgical history, and ancillary. Medical history refers to ongoing chronic medical problems that they may have, the most common being high blood pressure and diabetes. So what's going to happen in this rubric is you are going to need to say the components of history without anything in front of you. For instance, you're going to need to say, in medical history, this patient has diabetes, 2 points. Medical history, diabetes. Surgical history, the patient has had their appendix removed. Ancillary refers to test. The big general term for any tests that patients have done to them is ancillary studies. That could be blood work, urinalysis, x-rays, biopsies, any kind of test. So ancillary studies, a patient has recently had a CAT scan that was normal, or a patient has had blood work recently that showed anemia. So each one of these components is going to be for 2 points.
How recent is recent? So like if you had blood work done 2 weeks ago, could you use that like 2 weeks from then?
Yeah, well, that's a really good question, because really we only care about pertinent ancillary studies. I don't want to hear about the last 15 things you had done that were all normal. I want to know if you've had a CAT scan that showed an aneurysm. you know what I mean? So, but for the sake of this testing, all I'm going to want from you guys is the category for 1 point and an accurate example for point number 2. If you say, in medical history, this patient has had their appendix out. Nope, that's not medical history, that's surgical history. Okay? So then you're going to say, in surgical history, the patient had a tonsillectomy. I don't care what you use, and what you use does not have to be relevant to the eye or the ear. It's really just for you to show me that you know the components of history and what fits there. Okay, does that make sense? So I'm going to go over it really quick. Medical history is chronic ongoing medical problems. I would use high blood pressure or diabetes. They're by far the most common. You don't need to reinvent the wheel, okay? Surgical history, tonsils removed, appendix removed, spleen removed, I don't care. Anything that was removed is surgical history, okay? Ancillary studies is any test. You can't say they had no tests. You have to give me what's called a positive. They had a urinalysis done, which was normal or abnormal. I don't care. It's not going to be relevant to this. But you have to say something so I know you know what ancillary studies means, okay? Social history is really broad. Social history is married, single, what's your job, have you traveled anywhere recently that might be relative. You come back with a fever and weakness and you were just in, Africa, then we think of malaria, right? You know what I mean? So that's social history. That would get into things like sexual history if the complaint was potentially sexual. You don't ask people sexual history if it's not even in any way relevant to what they're there for, right? That's social history. Do they smoke? Do they drink? Social history. All I want is one component. In social history, the patient is married. In social history, patient smokes tobacco. Social history, patient drinks every Friday night. One or something that's social history, okay? Family history refers to anything that runs through the bloodline. So it has to be a blood relative that you are the progeny of. Okay, so it can't be a step parent, or if you're adopted, those parents. It has to be a blood relative. And what I would say here in family history, high blood pressure runs through the bloodline. Anything you want to tell me runs through the bloodline. Just tell me something runs through the bloodline. Medications. Well, those are going to be medications that the patient is on. And again, it doesn't have to be, if you say they're on diabetes, sure, you can say that they're on insulin, or they have high blood pressure, they're on a high blood pressure med. But you don't need to make this cohesive. You just need to show me that you understand the component. I'm only going over this because it's part of the rubric. My class, this is rubric number 4. So you guys didn't do 1, 2, and 3. This was taught in like 1 or something. You know what I mean? So we're just going over it really quick so that you guys can catch up. Then allergies. So you need to say allergic to amoxicillin or latex gloves or peanuts. You just need to give me something for each one of these so that I know you understand it. Does anybody have any questions about that?
So are they going to be gleaning this information from something you're giving them, or is this they are just making it
We're
up?
making it up.
Okay.
Yeah, so I'm going to say, we're going to go over the rubric, okay, piece by piece. And in the rubric, so you're going to be the student. And in this rubric, you happen to talk to the patient first, which is how it happens in real life too. If you go to nurse practitioner school or PA school or medical school, when you're training, you're going to go in a room and you're going to see a patient. Then you're going to come out to your preceptor and say, hey, I want to go over my patient with you. And you're going to start talking to your preceptor. That's exactly what you guys are going to do in this fake scenario, okay? So I'm going to say to you, you're going to come in and say, oh, I have a patient with ear pain or eye pain, because you're going to get one or the other. You don't know until it happens. Say, oh, I just saw a patient with ear pain. You're going to give me a little bit of the history of present illness, because you will have asked the patient some questions. And then I'm going to say, all right, great. Tell me about the patient's history. That's all you're going to get from me, and you need to say medical something, surgical something, ancillary something, dun, 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 dun. Each one of these being 2 points as a pair. Medical history, diabetes. Medical 1, diabetes 2. In surgical history, 1, appendectomy 2. Ancillary history, 1, they had a CAT scan recently, 2. Social history, 1, this patient is a smoker, 2. Family history, 1, hypertension runs through the bloodline. Am I just overdoing it here? Does that make sense? Okay, all right. Then we're gonna I'm just really catching you guys up so we can get to the ear and eye specific stuff. Constitution is the very first part of a physical exam, okay? Especially when you're presenting a case. You wouldn't necessarily say this to yourself. But so let's use an eye patient as an example, okay? Constitution always involves 3 components: age, sex, and your initial impression of the patient. So when you are presenting this patient to me, you can say, I can't remember what I have written down. We'll see that when we look at the rubric. Well, I have a 26-year-old male patient holding his hand over his eye and grimacing. Age, sex is easy, 26-year-old male. But you have to give me an impression of that patient. That's the Constitution. He's grimacing and holding his hand over his right eye, right? Or he says his eye hurts, but he's reading a book and he's not even blinking. That's the Constitution, okay? That's your first impression of the patient. So this is going to be 4 points in the rubric. I need to hear Constitution, because just like I said, okay, tell me about the patient's history, I'm going to say, okay, now tell me about the patient's exam. And the first thing you should say to me is, in Constitution, I need to hear the word Constitution. It's probably Jen. Oh. Yeah. The only people that call me is Jen and my wife. Nobody else, I don't have any other friends. Actually, Jen calls me more than my wife. My wife doesn't like me. Okay. Okay. All right. So I need to hear the word Constitution. Then I need to hear age. I need to hear sex, and something that you saw when you first looked at that patient. For those 4 points. Now, vital signs. You guys haven't done vital signs yet, okay? So in this rubric, as you'll see when we do an example, there's going to be a number of vital signs. That's worth 6 points, because you need to tell me that you offer to me that you obtained vital signs, because that's the second part of a physical exam. And vital signs are actually huge, okay? It takes, when you talk about doing practice, learning to understand how vital signs reflect physiology in a patient with a given illness based on age. You learn that for like the first 20 years that you're doing this. It gets more and more refined, okay? So the 6 points, and we will get there I think this year if we keep doing these, is 1, you're going to say, then I obtained vital signs on this patient. And the slide will show 5 vital signs. And your job would be to tell me the 2 that are abnormal. You guys can't do that because you haven't learned vital signs yet, okay? So I've already done that with my students, so that's part of this rubric. This is the same rubric that I use with my students. In your case, though, this is worth 6 points on the rubric. All you need to do to get those 6 points, and you don't want to forget this because it's 6 points, is say, and then I obtained vital signs. Then that slide will come up, and there'll be vital signs there, and we'll just like go past it or something. You know what I mean? But you need to offer Constitution. When I say offer, and this is medical terminology too, offer is an important medical word. Like I can go in and say, you have a headache? Did you have any numbness or tingling in your arms or legs, or did it come on suddenly? I can ask you all kind of questions, but if you say, no, but my carbon monoxide detector went off, you offered that to me, specifically without me prompting you in any way, shape, or form. When a patient offers you something, it's usually important information, okay? So anyway, offered is actually a medical word. You need to offer me Constitution. I'm not going to prompt you. I'm not going to say, tell me about the Constitution. You need to offer vital signs to me. I'm not going to say, well, tell me about the vital signs. But then I will say, all right, let's go on to the physical exam. And then we're into our rubric. So this is all just stuff that you and I have not done yet. So I'm just catching you up. And now the presentation is going to talk about the ear and the eye, which is where we get into the physical exam. Okay? And this is actually pretty good because the fracture rubric is a provider rubric as well.
Okay.
You know?